and ability to use their own techniques. We always try to develop a deep sense of responsibility towards professional life while pursuing the education. Let's start today's free CME on Ayurveda orthopedics. Today's topic is multidimensional approach and Ayurvedic approach in pain management. Today, Sir will be discussing two different cases, one on ankle sprain and another in undisplaced fracture. Explain you how his integrated knowledge in Ayurveda helped him to manage pain in such cases. So let's know our instructor. Our instructor is Dr. Swapnil Avinash Gawande. He is an Ayurveda consultant for pain, stress, post-sport injury. He has completed his BMS. After that, he has done his PGD in arthritic care. He has done his fellowship in sports rehabilitation from Apollo Hospital. He is the president of Ayurveda Foundation, Akola. He is a coordinator for Global Ayush Doctors. He is the president of Akola District and Indian Ayush Sports Medical Officer. He is also in Boxing Krida Prabodhini. He is the director of iStart Academy, Akola. He is the director of Ayurveda Institute of Pain and Stress Management. He was been the past president of JCI Akola City. He is also received many international certifications like Mastery Certificate in Manual Therapy from USA, Certificate of Osteopathic Manual Therapy, that is OMT from UK, Mastery Certificate in Soft Tissue Mobilization, that is HOS from USA, Certificate in Advanced Osteopathic Manual Therapy, OMT from UK. He has also done his certificate in Instrument Assisted Soft Tissue Mobilization from UK, certificate in Move Kinetic Taping, that is MKT from University of USA. He has also done his certifications in Marmatherapy, dry needling from TNT Chennai. He has done his certification in Emotional Liberation Breathing from Australia. He has also been an NLP master practitioner and trainer. Apart from this, he has also done his diploma in cognitive behavior therapy. So today he will be imparting all the knowledges which he has taken in past years, and he will giving us the gist of everything which he has learned till now. So whatever we are going to hear from him is not from his past academic years of UG or PG. It is also from his experiences and all the learnings of all the courses. Okay. So let's begin our today's session. Thank you, Swapnil Gawande sir, for being with us. And I am also pleased to inform everyone that Dr. Swapnil Gawande sir will be giving us a free seminar in the month of May also, and in the month of June also. So be in touch with us so that maximum knowledge from Dr. Swapnil Gawande sir. Thank you, sir.
Thank you very much, ma'am, for the elaborated and much more elaborated, I must say, the intro. So I would request you to kindly stop your screen sharing. So we will start today's webinar because most of the people are waiting for long. So friends, I would like to know from you that some of the people were speaking or messaging that the screen or the voice was low. So is still the case with me, or are you properly audible? Am I properly audible to you? Very clear and loud I want to be. Okay, thank you very much, friends. So let's come on the topic without wasting the time, because all must have been tired, because today is a working day and all must have been tired after completing their OPD. So friends, before starting a lecture, I would like to share some of the facts about the pain management or the pain with you all. As you all know that the pain is the single most common symptom in all the diseases. Approximately each and every illness consists one or other kind of a pain. So it means that when we see towards a, and every patient, almost every patient comes to you कि डॉक्टर साहब ये दर्द कम करा दो बस, बाकी ठीक हो जाएगा लेकिन ये दर्द पहले कम करा दो. Do you agree with me or not? Do you agree with me? This session is going to be interactive, so please message fast. Is this the scenario with you also? Because this is the most common scenario with me. So sometimes there is a myalgia, sometimes there is a specific joint pain, sometimes there is a headache, sometimes there is a very unique kinds of pain we heard from the patient. Sir, मीठा मीठा दर्द हो रहा है, सर हल्का हल्का दर्द हो रहा है, सर बहुत तेज दर्द हो रहा है, कोई बोलता है कि ऐसा दर्द हो रहा है जैसे कोई मेरे सर में पीट रहा है. एंड वी ऑल हैव लर्न दिस इन आवर graduations and through our experience. I can see that there are lots of practitioners. I know personally there are the practitioners who are more senior, who are junior, and everybody is getting hurted by these pains of the patient, and every physician want to subside or want to treat the pain of a patient. So, when speaking about the pain, let's start with some presentation that what this pain actually is, or what does this pain means. And we are going to discuss two of the cases, and then some of the understanding of the pain. Okay, and then I am having the some of the bonuses and some of the surprises for you all. So stay tuned till last, and we will keep interacting. So quickly, I will start sharing my screen. Okay, friends. So, on behalf of Integral Indopedia Ayurveda Skularka and Arvachin Ayurved Gurukul, I, Dr. Swapnil Gawande, welcome you to this pain management, the multidimensional approach in the Ayurveda for the pain management. So, what is, because you all know that there are the cases, there are the patients we have after treating or after giving lots of medicines, after doing some or the other therapies or doing some or the other modalities, there are the patients that they still have the pain, or sometimes the patient feels good that okay डॉक्टर साहब आपने ये ट्रीटमेंट किया मुझे बहुत अच्छा लगा, लेकिन 2 दिन बाद या कुछ दिनों बाद वापस वो पेन रिकरेंट हो गया है. So, therefore, I always insist that pain has a different phase. जैसा हमने हमारे माइथोलॉजी में पढ़ा है कि जो कोई भी रावण होता है, हर पिक्चर में, हर इसमें एक राम होता है, एक रावण होता है, एक हीरो होता है, एक विलियन होता है. तो जो ये विलन होता है, वैसे ही डॉक्टर्स के लिए, पेशेंट्स के लिए पेन एक विलन है. और जैसा रावण एक दशमुखी था, दशानन था, उसी तरह से पेन भी बहुआयामी है, बहु डायमेंशनल है, मल्टी डायमेंशनल है. इसके लिए उसका ट्रीटमेंट पार्ट भी मल्टी डायमेंशनल होना चाहिए. सो विल जस्ट understand this, like this lecture is going to be the bilingual. So I will explain some of the thing in English, some of the things in the Hindi, because every participants, most of the times participants request us to explain in both the languages. Okay, so multidimensional approach in the Ayurveda for the pain management. So first of all, we will understand the what is the pain. So what is a pain? According to the WHO definition, that is World Health Organization definition, an unpleasant sensory or emotional experience associated with the actual or the potential tissue damage or described in the terms of such damage is called as a pain. So understand one by one aspect of this definition. The first, the unpleasant sensory or emotional experience. Because हम बोलते हैं आज मेरा दिल दुखा, I have been hurted. So though there is not a physical pain, but we still feel the pain when we are emotionally upset or we are emotionally in the sorrow. Okay, so that is also considered to be the pain. Then it is the actual or potential tissue damage. What does it mean? That when there is a cut, when there is a bursting, or there is a, if you collide with something, or you are being hit with something, then the tissues like muscles, your ligaments, your tendons, or the bones got hurted. That is the tissue damage, and that tissue damage, the symptoms arise from that tissue damage is a pain. The last sentence of this definition is very interesting, that the describe in the term of a such a damage. For example, if a patient is coming to you and he is telling that डॉक्टर साहब मेरा ये मसल बहुत पेन कर रहा है, डॉक्टर साहब मेरी हड्डियां दुख रही है, डॉक्टर साहब मेरे हड्डियों में दर्द रहता है. So actually you can't see that there is not a potential or actual tissue damage, but the patient is describing in that manner. So it should also be considered in this definition of the pain. So here we can understand that what is a pain according to the WHO. Okay, then moving to the next, that this happens, that what is a pain, but what pain actually is? What does actually the pain is? Or what does the pain mean? So moving forward, we can say that what is actually the pain pathophysiologically. So what is pain pathophysiologically? The pain is a signal in your nervous system that something may be wrong. It is an unpleasant feeling such as a pricking, tingling, sting, burning, aching. Pain may be sharp or dull. It come or go. It may be on and off, or it may be constant. It may be acute. It may be chronic. Okay, so pain is the first important thing, is that the pain is a signal in your nervous system that is indicating that something is wrong at that particular place. For example, a patient is complaining that my headache, I have a headache, I have a severe headache, or I have a temporal headache, or I have a frontal headache, or any kind of headache. She or he is complaining, that it means that there is something wrong, that that nervous system is signaling to your subconscious mind, or that particular place is having some trouble. So this particular sensation, or this particular part in the vernacular language, we said that the generalized pathophysiology of the pain. Then, as I have said, at most of the time, you all know that there is a common saying in Ayurveda, एक बहुत ही प्रचलित वाक्य है आयुर्वेद में, जिसमें कहा जाता है बिना वात नस्ति रुजा. बिना वात के रुजा या पेन नहीं हो सकता. देयर कांट बी अ पेन विदाउट द इन्वॉल्वमेंट ऑफ द वात दोषा. So what and in the modern science, what modern science say, that there could not be pain without the involvement of the nervous system. So how these two different things are the same, we are going to see how can we synchronize them. So according to the Sushruta, the everything in your body, every anatomical movement and the pathological, physiological movement, and every Jnanartha Grahan, that is all our Jnanendriyas are working, all our senses work in the synchronization in this particular Vata निदान अध्याय, इन द निदान स्थान ऑफ द 10th श्लोका, अकुपित वात कार्य बहुत स्पष्ट रूप से सुश्रुत ने कहा है कि अकुपित वात दोष धातु तथा अग्नि की सामता रखने वाला, शब्द स्पर्श रूप रस गंध इन 5 इंद्रियों में मन को चक्षुरादि इंद्रियों के साथ संयुक्त करने वाला तथा शरीर की श्वास प्रश्वास पाचन संचार रस संचार आदि क्रियाओं को तथा पंच कर्मेंद्रियों और इंद्रियों को वचन आदि क्रियाओं को ठीक ठाक रूप से करने वाला है। जैसे कि मॉडर्न साइंस में कहा जाता है कि यूर बॉडी, यूर ऑल द मूवमेंट्स एंड यूर एवरी फिजियोलॉजिकल, पैथोलॉजिकल एंड एनाटॉमिकल थिंग्स आर बीन कंट्रोल्ड विद द your nervous system, by your nervous system, and the same thing is said by the Sushruta. So it means that already our acharyas, our granthas, our text accept that what is the only karak, that is what is only responsible for every condition, okay, or every movement in the body. So as we have learned that kapam pangu pittam pangu pangave mala धातुवाः, जैसे कि कहा गया है कि त्रिदोष, हमने फर्स्ट ईयर में पढ़ा था कि त्रिदोष ये 3 देवों जैसे है, तो उसमें सबसे प्रमुख देव हमारा वात ही है, क्योंकि कफ भी पंगु है, पित्त भी पंगु है, दैट इज दे कांट डू एनीथिंग सेपरेटली विदाउट इन्वॉल्वमेंट ऑफ द वात विकार, एंड हेंस we can directly correlate and we can directly synchronize the Vat Vikar with the nervous system or involvement of the nervous system. What Vagbhata says about it? Vagbhata says that कि सभी नॉर्मल क्रियाओं के लिए शरीर में जितनी भी नॉर्मल क्रिया है जो हमने पहले भी सुश्रुत के श्लोक में देखी, उसका सबका कारण विश्व में सब नॉर्मल क्रियाओं के लिए वात यही कारक है या कारणीभूत है, और जो भी अदृष्टवात है वही सारी नॉर्मल क्रियाओं को, साम्य अवस्था को, शरीर की साम्य अवस्था को रखने में मदद करता है। और अगर यही बिगड़ जाए तो कोई भी दोष उत्पन्न करने के लिए वात दोष का इन्वॉल्वमेंट जरूरी होता है। ओके, सो दिस इज हाउ इंपॉर्टेंट द वात विकार और द वात इन द क्लिनिकल प्रैक्टिस। मूविंग फॉरवर्ड, दैट आई हैव टोल्ड यू कि pain has a multiple dimensions or multiple effect on your बॉडी, और मल्टीपल इफेक्ट की वो दशानन की तरह है। हमें इसलिए उसका जो 10 मुखों वाला जैसे रावण था, वैसे ही जो कॉमनली एक्सेप्टेड है, ग्लोबली एक्सेप्टेड है, इस दर्द नाम के राक्षस के 7 मुंह है। दिस डेमन कॉल्ड पेन हैज द 7 डिफरेंट dimensions. These dimensions are important. Why these are important? Because these are important because these affect not only the patient, not only the severity and the type of the pain, but these also interrupt or also make the influence over the treatment part. So these dimensions are not only troublesome for the patients but are also troublesome for the vaidya. So we will look one by one. These 7 basic dimensions are the physical, sensory, behavioral, socio-cultural, cognitive, affective, and spiritual. As there is a lots of things I want to say, lots of things I want to share with you, I am going a little bit faster. At the end, if there are some questions, we will have the question answer sessions. So please bear with me. I am moving a little bit faster. Okay, so first on the physical pain, it is all you know that the physical pain is that the particularly it may be because of the physiological aspect, it may be because of the anatomical aspect. Quickly we will see the 2 examples. If you are being hit with something, or if you are collide with something and you got a hit on your shoulder, then your shoulder will have the pain. Or if it is having the swelling, or if something bites on your shoulder, you will have the pain there. So this is a physiological physical pain. And if you got the viral fever, or if you got the viral fever or some febrile illness, then you will have the myalgia. Then also it will be the physical pain, but it is because of the physiology. And if the anatomical structure is disturbed, then it will be the anatomical. So physical, this is the physical aspect of the pain or the dimension of the pain. Then the sensory pain is generally the radicular pains, that the cervical pain because of the mm, cervical spondylosis or the compression in the cervical or vertebral, cervical or lumbar vertebrae, the pinching of the nerve or the impingement of the exiting nerve root may cause the referred pain. Like for example, if a patient is complaining about the pain in his wrist or pain in his forearm without any history of trauma or physiological symptom, then we come to conclusion that the pain may be radiating from the cervical spine. So that is what is the sensory part. Then the behavioral pain. So this is somewhat associated with the psychology. For example, if somebody is telling that whenever I got angry or whenever I got depressed or whenever there is an exertion or whenever there I do a particular behavior, and the particular part for the most common thing is the headache. There may be the other there may be the other kinds of pains also. There is a theory also, psychological synchronization of the pain, that if somebody is feeling burden on his shoulder, then his shoulder will pain, though there is no pathophysiological findings in the shoulder, but because of his feeling of being stressed out because of some of the responsibilities, then his shoulder will be have pain. So this is called a behavioral pain. It may in the two men, because of the behavioral pain will elevate, or because of the pain the behavior will affect. The second is socio-cultural pain. So the best example for the socio-cultural pain is that the pain during the menstrual cycle for the women. In our society, when the adolescent girls start with the menarche, or even though the adolescent and young adult girls, like newly married girls and the teenager girls, are being socially taught that the pain during the periods, the pain during the menstrual cycle are very common, and they accept that okay, it उतना तो होता ही है सर, वो तो normal pain है. They don't bother that pain, and these kind of beliefs, these kind of socio-cultural things uh, can affect the treatment part. For example, a patient comes to you um, with the low back pain, and or for the thoracic pain, and you ask all the history, and you try to find the reason for the pain or the pathophysiological for the pain, and because of this socio-cultural belief that the lumbar pain during the periods is normal, she will not give you the proper history. And because of that proper history, not giving proper history, you may miss an important thing. How you can miss that, we will see later. Sorry. Then coming to the cognitive, is there any issue? Okay. Friends, I will request that please don't put the messages unless I tell you to put, because when I am sharing, I am totally uh, sharing you with the full screen. So if you message, it disturbs the screen. So whenever we will have the interactive part, I will ask you to put the messages. Okay. Then coming to the cognitive is the, what is meant by the cognition? The cognition is the common sense thinking. So, because if the patient can't bear a stress, a patient can't bear a particular situation, then the pain starts. Or if a patient is having a particular mindset or the attention seeking syndrome like this, what she will start causing that the most important or the most common symptom, that we call it as a exam fever in our childhood. That if a patient, if a boy or if a kid is not comfortable in going to school, or if he is fearing about the exam, or he is fearing about, or he has not completed his, or he or she has not completed his homework, and now he is fearing to go to the school, then he will टेलिंग दैट मम्मा मेरा हाथ दुख रहा है, मम्मा मेरा पेट दुख रहा है, मम्मा मेरा कुछ ना कुछ पेन हो रहा है. So this kind of या फिर those people who are practicing daily in general practice or maybe in Ayurvedic practice, you may come across with these kind of kids कि डॉक्टर साहब ये हमेशा ही बोलता है कि मेरा हाथ दुखते रहता है, ये हमेशा ही बोलता है कि इसका एक्सरे कर लिया, सब कर लिया, लेकिन कहीं निकलता नहीं है, लेकिन ये बोलते रहता है कि मेरा पैर दुखता है, मेरा हाथ दुखता है, मेरा सर दुखता है. तो these are most of the time the cognitive dimension or cognitive aspect of the pain. Then the affective pain. The affective pain is particularly when a patient is got benefited from the pain. So you will call that how a patient can have the affection for the pain or the benefit for the pain. I will take some time to share a story so that you can understand the properly the dimension of the pain. I think in the last year, I got a patient, a 34-year-old person, having a good physique, good body composition of low back pain. I have almost tried everything for his pain, but his low back pain never goes away. Then suddenly what happens? He skips away. So normally हम जैसा सोचते हैं कि कोई पेशेंट अगर आना बंद कर दे अचानक, तो या तो वो ठीक हो गया है या तो वो हमसे ठीक नहीं हो पाया और उसने डॉक्टर बदल दिया है, उसने ही हैज चेंज द फिजिशियन. सो मैंने भी कॉमनली यही सोचा, बट आफ्टर 1 मंथ ही कम्स अगेन एंड सेड डॉक्टर साहब महीने भर से पेन कम था, अभी पेन बढ़ गया. तो मैंने उससे पूछा कि भाई क्या हुआ ये महीने भर में, तो वो बोला कि मैं थोड़ा 15 दिन अभी मैं दोस्तों के साथ बाहर गांव घूमने गया था. हम 10-15 दोस्त घूमने गए थे. तो मैंने कहा कहाँ गए थे आप, तो बोले हम कोकन में गए थे. बोला वहां पे तो बहुत चढ़ाई होगी, पहाड़ होगा, तो वहां पे तो आपका पेन और तकलीफ नहीं. बोले सर
आ, 2 मिनट के लिए सब जन वेट कीजिए। कुछ तो भी टेक्निकल प्रॉब्लम है। आ, 2 मिनट के लिए प्लीज आप सभी लोग वेट कीजिए। 2 मिनट में सर वापस सर 2 मिनट में ज्वाइन ही होने वाले हैं। हेलो।
Hello everyone. Sir is trying to connect again. Please stay. The important topic of ankle sprain and undisplaced fracture is coming on. We usually see these cases in OPD also. So please stay connected. Sir is trying hard to connect again.
Yes, sorry friends, because yes, because of some power cut, it was a disturbance into the course. Extremely sorry for this disturbance. Just give me a second. We will come back to our part. So, sorry. So I was sharing with you a case of affective dimension or affective aspect of the pain. So that boy was, I asked him that you wander here and there, you are in the severe pain, you were unable to walk or you were unable to sit, and you are having so much pain. So how could you make the travel, and how could you manage the climbing and all these things? So he said that I don't know, sir, but I was very comfortable at that particular trip. So when I asked, okay, then what makes you to come again to the me? Then he said that, sir, as soon as I'm back from my visit and I have started sitting in my brother's hardware shop, my pain again starts. So I got to, I don't give him any treatment, and I ask him about his family matters and all. So I come to a conclusion that that particular boy was having some trouble or having some family issues with the within his family, and his younger brother was forcing him to look after his hardware shop and sit at that particular shop, and he himself wants to do the travel business, and as he was forced to that particular job, so he was stealing because his MRI was normal, his X-ray was normal. Sorry, friends, there is some uh, network glitches happening. It is disturbing. Okay, is there, na? Okay, then coming to the spiritual. I hope that you got the affective part. So that pain was helping that particular patient to get rid of that shop, because his complaint was that whenever I sit for more than half hour or more than some particular period, I got the back pain, and uh, hence that pain was helping him, and in that way uh, this is the example of affective pain, and in that way it affects the your treatment and your diagnosis also. So we have to be very vigilant while treating these kind of chronic patients. Then the seventh dimension is the spiritual dimension. The spiritual dimension is that uh, some of the patients have the tendency that the pain is good. So pain is good, and they don't want to take the medicines. They don't want to take the treatment. They don't want to be treated for particular pain. और वो ऐसा समझते हैं कि ये मेरे पिछले पापों का कुछ फल है, कुछ प्रायश्चित है। तो इस काइंड, या फिर आपने देखा होगा कि आई एम नॉट अगेंस्ट एनी पर्टिकुलर रिलीजन और एनीथिंग, but or any practices or any religious practices, but I have came across this that in South India, in some of the places, they prick the needles and they prick the knives all over the body and they got injured because of it, but they don't want to get treated for that. In also in the rally of the Muharram, they hit themselves with the knives and with the some hard objects and they got hurted and they don't want to be treated because they think that this is the my spiritual belief that I don't want to be treated with uh, treated for this particular pain. So this aspect also affects the treatment part because this spiritual aspect uh, stops or this resist the treatment. So हमने ये 7 एस्पेक्ट देखे और जब भी हम पेन किसी पेशेंट का देखते हैं तो आई थिंक दैट कि हमें इन सातों चीजों को, ये सातों फेसेस जो मैंने बताए, सातों डायमेंशन जो बताए पेन की, इनके बारे में सोचना चाहिए. Then moving forward, if all are there well educated doctors and practitioners, so I will briefly compile this. This is the 5 main or 5 common types of the pain, that is acute, chronic, neuropathic, nociceptive and radicular pain. As you all know that the pain which is arise because of the sudden event or because suddenly or within a short period, that pain has started and will subside because of some or the other treatment, then it is acute. The chronic pain, it is for more than 3 months or more than 6 months. There are different definitions according to the different text for the chronic pain, but we consider it as more than 3 months. It is a chronic pain. Or when we are speaking about the sport injury management or a particular occupational injury, then it is also called as a overuse injury or overuse pain. For example, there is a bowler and he is bowling again and again with the same hand, then he is having the shoulder pain, then it is a chronic or overuse pain, we can say. Neuropathic pain, when there is a neuron, it's your nervous system or the nerves are damaged, or there may be because just like in the burn, there is a neuropathic pain. Nociceptive pain is a pain which is because of the nociceptors. For example, there is a swelling or there is a some bite, some unknown or insect bite, and that sensation of the pain we call it a nociceptive pain. And radicular pain, which we have discussed earlier, that is which is radiated from the cervical or the lumbar or any segment of the spine to the particular distance or distal part is called as a radicular pain. Then what actually the samprapti according to Ayurveda for the pain or the Vat Vyadhi, then these can be concise or this can be collide in this particular 2 types of samprapti, that is Troto Pradhan, that is the Aurojanya, and the Dhatukshayjanya or the Kshayjanya Vatvikar. So the Hetu Sevan, that all the Hetus that you overuse might be trauma, Nij, Agantus, both the Hetus are there. Then the Prakop, and when Vat Prakop happens, the guns of the Vat starts seeing that वहां रुक्षता बढ़ जाती है, परुषता, खड़ता, these are the गुण जो बढ़ जाते हैं और उसकी वजह से जो खाली स्त्रोतस है वहां पे वायु पूर्ण हो जाता है. There is a collection of Vat and then it starts the degenerating that particular धातु. फॉर एग्जाम्पल अगर वो अस्थि में वात प्रकोप हो जाता है तो वो अस्थि के जो स्त्रोत से वहां पे रुक्षता आने लगती है, परुषता यानी वहां पे जो बोन डेंसिटी है वो कम हो जाती है, वहां पे रफनेस आने लगता है और जो माइक्रोपोर्स होते हैं बोन्स के वहां पे दोष का पूर्ण होने लगता है, वो फिलिंग ऑफ दी वात दोष एंड इट क्रिएट्स दी धातुक्षयजन्य जिसको हम ऑस्टियोपोरोसिस बोलते हैं. देन स्तोत्रोत प्रधान वात व्याधि में सेम हेतु जो होते हैं बिकॉज ऑफ द कफ, बेसिकली कफ और कफ से उत्पन्न होती है और आम उत्पन्न नहीं होती है अगर पित्त का ठीक से नियमन ना किया जाए. इफ देर इज अ increased pitta, or the most common in the old age is a lean pitta. If the pitta is not treated properly in younger age or in the childhood, then it becomes the lean pitta and causes the am utpatti, or the atap sevan, sheet gun sevan, amla padartha sevan. These all creates the amotpatti or the kapha prakop, and they start obstructing the strotas. That is, we call as the strotorod, and which obstruct the natural or the normal gati or the normal translation of the vata dosh into the body, and this disturbs the samvayu. So samvayu का स्त्रोतगुण्य होकर वहां पे स्थान वैगुण्य वो निर्माण कर सकते हैं, और that is what we call the Vat Vyadhi Stroto Pradhan. I am not going into deep because you all know this very, because these are the basic thing we have learned in our graduation. Okay, then moving forward, here I am going to share you with a case of ankle sprain. Okay, so in this particular case of ankle sprain, there may be a problem with the sound in the video because it is already recorded live. It is not recorded with a high-tech other devices. So I am going to narrate the video. You just observe the video what I am doing. So this is a I'm a 20-25 years boy with the ankle sprain while running. So he is complaining me about the pain in that particular position where I am palpating with my fingers and thumbs. You can see that I am palpating, pressing. That is there any swelling, is there any pain, or is there any shooting pain? Now I am looking for the active movement. This is called as the active movement because the patient is doing himself, and I am observing that all the ranges of the motion of the ankle are normal, or is there any problem? So now he is telling me that when he is moving the or dorsiflexing the ankle, he is having pain, and when towards laterally I am twisting, then he is feeling better, and when I am twisting it medially, he is having pain. So this is called the passive movement. The passive movement is that what I have done with my hands, not using the patient his or her force. So now I am palpating again and confirming the site of the abnormality, that where there may be a problem. So now I am going more specific into the particular pinpoint place where the pain is there. Because after palpating, I got to know that in this particular area, the pain is located, or it is the origin of pain. So now he is telling that I am having a slight pain here. Now you can see that here is the site of pain. So actually this is a tendon of brevius muscle. And that tendon has got hurted. I come to know. So this is peroneus, brevius and peroneus longus. I come to an conclusion that the pain is at the peroneus brevius muscle. And also there is a stretch on the retinaculum there. Retinaculum are the thick bands of the fascia, which sometimes may confuse you with the ligaments. I got to know that here is a pain site. So the tendon of the brevis longus muscle, and here I am doing the Gambhir Vedan Karma or dry needling. So that if there is a muscle knot or so if there is some of the obstruction, also dry needling helps to create the micro trauma, which micro trauma then gives the signal with the nociception that here is the pain, and there diverts the all the mechanoreceptors got the message that here is something wrong, and all our healing power, all our healing energy diverted at that particular place. So it works dually, as to remove the obstruction also and as to remove the on to give the signal to the brain also that here is the place where there is something wrong. So all the healing enzymes, all the healing chemicals in our body are diverted towards that particular place where we are doing the needling. And here with the poking of the needle in and out, I am trying to find that is there any tendon knot or is there any obstruction. Okay. As you know that in Ayurved, to tendon we called it as a kandara, and Shira and kandara are the upadhatu of Rakta Dhatu. So I am going to do here the Rakta Mokshana. Here I have tied actually the latex gloves, so that it will create the it will work like a tourniquet and will have also the flexibility, that it will be more prominent. And here we are going to do the Rakta Mokshan. You can see that the color of the blood is very brownish, very dark black, and it is also very thick. So now I am asking him that how is the severity of the pain, and he is telling me that the pain has been reduced. This is a real-time video. It was not shooted in segments, though some parts, the extra part are being removed. Now I am asking him on the numerical scale, because this is the best way to understand the pain of the patient, by telling him or by asking him in the new number that if he is having 10 out of 10 pain, then how he is now having the pain. Look, what we have done, we have first diagnosed the patient, then we have done the dry needling so that we can direct the healing energy and also to remove the obstruction. Then I am stabilizing that particular joint, because the tendon has been hurted, and it is not like that if I have done the dry needling and the Rakta Mokshan and the pain has been reduced from 10 to 3, but the tendon will take its own time to recover. The tendon will take its own time to be stabilized. So to stabilize the tendon, we have to do the complete treatment. Now in the figure of 8 bandaging, I am fixing that particular tendon or injured part with the crepe bandage. And you can also observe that I am tying the crepe bandage from medial to lateral, not from lateral to medial, because if you remember while diagnosing, the patient was telling that when he is medially twisting or medially turning the ankle joint, he is having pain at the lateral aspect. It means that the tendon was stretched laterally. And what will this do? This will shorten that tendon which has been stretched, and it will help in realigning or reuniting the torn or the broken fibers of the particular ligament. Also, there may be a facial distortion, retinaculum distortion, that will also be taken care with this crepe bandage support. And also, while he is walking, while he is putting the pressure on the particular leg, he will feel more stable. So always remember, while treating the pain, just don't focus on that particular pain. Also focus on the recurrence of the pain. Now you can see that he is saying that more stability or more support I am feeling on the pain, on that particular ankle. So I am asking him to put some little more pressure. Okay, so this was the first case. The next case we are going to see, this is a very short case. This is a case of undisplaced fifth metatarsal fracture. Okay, so here you can see that in this particular arrow here, if you can see that this is the undisplaced fifth metatarsal fracture, and the patient was having the swelling and can't put the leg on the earth on the ground, and was unable to walk. As the patient was a ladies patient, so I can't shoot the complete video. So the most important part was the treatment portion, how we treated this undisplaced fracture. So we are using this Sandhana clave. Most of the drugs in this Sandhana clave are from the Sandhana Gana, said by the Charka. By boiling that particular to reduce as a lay, you can call it also the pralep. Sorry, yes, pralep. So it should not be the khara. It should not be too liquid. It should not too dry. So this is how we have covered that particular total portion. Now I am using this belladonna fracture. This belladonna fracture, why? Because that belladonna plaster itself has a swelling or the anti-edematous property, and also it will keep the airflow so that the patient will not have the irritation. Then for more stabilization, we are enwrapping it with the cotton, and over this cotton we will stabilize it with the crepe bandage. Again, now you can see that I want to stabilize that particular fifth metatarsal. So I will now tying or binding the crepe bandage from medial to lateral, so that the pressure on the fifth metatarsal should not be increased, or that metatarsal should be given support from downwards also and from laterally also. If we will tie it from lateral to medial, then the fifth metatarsal will be depressed and it may cause discomfort. This is how we have fixed the, and every fifth day or the sixth day we change this labor. While tying or binding the crepe bandage, always be careful that there should not be the wrinkles. So you can see that how we have fixed, and for the more stabilization we have fixed the cotton tape over it. So friends, now we will discuss these two cases in a brief or manner, that both the injuries we have seen, or both the kind of pain we have seen, are consisting two different aspects. Okay, the hard tissue, the second one was the bone fracture, that is the hard tissue, and the first one was the soft tissue injury. Because the tendon, ligaments, and retinaculum was involved. It's okay. So the retinaculum was involved. So we will briefly see that what are the features or the symptoms. So when there is a hard tissue, how you got to know or can guess that there is a fracture inside? Because most of the time there might not be the over the skin injuries, might be no crack or no abrasions may be there. So there may be the bursting and the swelling. Then the pain will be the due. Also, there may be a shooting pain, the unbearable pain that may be because of the nerve damage which is passing through that particular joint. The limb or the area of the body where the break becomes immobile. So where there is a fracture, as I have told you in the second case, the patient was unable to put his leg on the ground, also was having very much severe pain in moving that particular foot. So that becomes immobile automatically. And if it is a bad fracture, the area will look obviously deformed. So as you know that in this picture also you can see that this area is looking deformed. The formation seems to be weird. Okay. So now in the soft tissues, the soft tissue, they can be of two types, that is the open injury and a closed injury. And open injury means that the skin has broken, the blood usually is escaping from that particular injury. Open injury include the cut, grazes, blisters, and the chafing. Okay, the closed injury, you can see over the symptoms of that injury, or the what the dimensions of that particular injury can be seen on the skin. And in the closed injury, it occurs beneath the skin. There is no external bleeding. वहां पे ऊपर से आपको bleeding नहीं दिखेगा, cut नहीं दिखेगा, कोई भी mark नहीं दिखेगा, but patient का पैर immobile होगा, उसको दुखेगा, उसको बहुत ज़्यादा severe दर्द होगा. So this is called the closed injury. और closed injury में bursting होगा, बर्सिंग होगा. उसके बाद में वहां पे पुल जैसा खिंचाव महसूस हो सकता है, स्ट्रेन और स्प्रेन हो सकता है. ओके, जो स्ट्रेन होता है वो मसल में होता है, स्प्रेन जो होता है वो लिगामेंट में होता है। रिमेंबर दिस, स्ट्रेन जो होता है वो मसल में होता है, स्प्रेन जो होता है ये लिगामेंट में होता है। ओके, सो हमने दो केसेस देखी, दो केसेस में हमने एक केस में देखा कि जिसमें हार्ड टिश्यू ट्रॉमा है, हार्ड टिश्यू इंजरी है, और दूसरा जो है जिसमें सॉफ्ट टिश्यू इंजरी है। I once again request you all the delegates that please don't message during the during when I am speaking. We will have the question answer session at last. Okay, because it is disturbing the screen and it is diverting the focus. Okay. Okay, sorry. हाँ, सो नाउ जो सॉफ्ट टिश्यू इन्वॉल्व थे, तो कौन से सॉफ्ट टिश्यू इन्वॉल्व थे? तो मेन देयर आर द 4 टाइप्स ऑफ सॉफ्ट टिश्यूज। मेनली देयर आर 4 टाइप ऑफ सॉफ्ट टिश्यूज, जो इसमें फिर नर्व भी आप जोड़ लो, बट दे आर वेसल्स, नर्व, आर्टरीज एंड veins. These are vessels, but the main tissues which are involved here are the muscles, fascia, ligaments and the tendons. तो हम मसल्स, लिगामेंट्स और टेंडॉन्स के बारे में तो बहुत बार बात करते हैं, लेकिन फेशिया जो होता है इसके बारे में बहुत कम बात की जाती है। जैसे कि मैंने एंकल इंजरी में एक चीज बताई कि रेटिनाक्यूलम, तो रेटिनाक्यूलम ये एक फेशिया का एक बैंड होता है। तो व्हाट इज मीन बाय द फेशिया? फेशिया इज अ सेकंड लार्जेस्ट ऑर्गन ऑफ योर बॉडी विच कनेक्ट्स, विच एक्चुअली वर्क एज अ कनेक्टिव टिश्यू। ऐसा समझ लीजिए कि ये जो फेशिया है आपकी बॉडी का फेविक्विक है, ये हमेशा आपके दो ऑर्गन्स को चिपकाने का काम करेगा। फॉर एग्जाम्पल, आपका स्किन है, तो स्किन के नीचे फेशिया है, उसके बीच मसल है, दो मसल्स के बीच में फेशिया है। या जिन जिन लोगों ने बहुत अच्छे से डिसेक्शन किया होगा अपने कॉलेज में, या जिन्होंने सर्जरीज को देखा होगा, तो यू मे हैव सीन दैट फेशिया को रिमूव करना पड़ता है मसल तक पहुंचने के लिए। दैट फेशिया ऑल्सो प्लेज एन इंपॉर्टेंट रोल। कुछ कॉमन एनाटॉमिकल टर्म्स देख लेते हैं। जो लिगामेंट्स, जैसे मैंने बताया कि जो बोन को बोन से जोड़ते हैं उसे लिगामेंट कहते हैं। मसल्स को नॉर्मली बहुत बार मायो से स्टार्टिंग होता है, जैसा माइलोपैथी हो गया, माइलाइटिस हो गया, मायोपैथी हो गया। जब भी ये वर्ड्स आपकी किसी भी रिपोर्ट्स में, एमआरआई या सीटी स्कैन में आए, तो देन when joint is commonly these all are Latin words. Joint are commonly denoted with the ortho, like orthoscopy, orthoplasty. Tendons are commonly represented with the tendo, like tendosis, tendinosis, tendonitis, like this. And cartilages are termed as chondro. So you may have read most of the time in the knee X-ray or knee MRI, that is chondromalacia pateli. This is one of the most common degenerative conditions in the elderly people, so with the knee joint. Then bones are called as the osteo, so osteopathy or osteoporosis. Like this, the osteo is the word used for the bones. Then the pathological terms, the tear, the sprain, strain, and rupture are the common sin. For example, if there is, I call the tendon tear, it means that it is a tendon sprain or tendon strain, or tendon rupture. This is all the sometimes are called in the same manner. Then their muscle strain is there or muscle rupture is there. It is same as the tear. Hematoma, all you know that hematoma is sometimes called as a cork also. And as fracture, you know that mainly it is related to the bone. When there is a disintegration of the particular structure is called as a fracture. So the bones are basically used for the fracture. And then the dislocation. Dislocation is that the sthan vaigunya in our Ayurveda, when there is the displacement of the joint, that is one joint is the two bones, if a joint is consist two bones, then they are displaced from each other. It's called as a dislocation. I know that this all you are well versed with, but still I am revising it. Then itis, as you know that itis means the inflammation, the protective response to the damage as well as the initiation of the healing. It plays the dual role that it protects the it is a response as a protective mechanism of our body, and it also initiates the healing, and not the same as the infection. As you all know that the infection is not same as the inflammation. Then the common use, as we have when we integrate this term with the soft tissue term, that is tendonitis, arthritis, neuritis, and myositis. Myositis. Okay, so this is all about the modern anatomy which we have seen, but how we can relate, as we are saying that we are the Ayurveda practitioners, and this is a Ayurveda ortho segment we are speaking, and we are all so we can integrate or synchronize this with the Ayurveda dhatu vichar. Like bones obviously are the asti dhatu, ligaments obviously are the upadhatu of made, that is snayu. Then tendons, that is Sira and Kandara, that are the Upadhatu of the Rakta Dhatu. So as I have said into the ankle sprain case, that the patient is having the Kandaragat Vat or the ankle sprain. So we have done the Rakta Mokshana there. Muscles, obviously the Peshi, the Mans Dhatu, the meniscus are the collaboration of Med, Majja and Vasa. This synovial fluid in the synovial joints, like in the facet joints, in the knee joint, or in all the synovial fluid, there is a Shleshma Dhara Kala. We can say that it is a Shleshma or Shleshma Dhara Kala, and Barsa can be synchronized or can be compared with the Picha. Okay, so Barsa are basically the fluid filled pockets which are between the tendons, ligaments, and the muscles to minimize their friction over each other. So this is how we can do the comparison, and according to this comparison we can find the references for that particular dhatugat vat lakshana and can treat it in the Ayurved manner. So this is how we have seen the this is how we have seen that the two cases in which in the first case there is a soft tissue injury, in the second case there is a hard tissue injury, and then we understood that how this both the injuries or both the pain conditions can be understood in the Ayurveda terminology, in the Ayurveda point of view, and in the modern point of view, because as I have said you that it is a multidimensional approach. So in this multidimensional approach, you can also have the approach which I have called it in the first case of Snayugat Vat or the ankle sprain. The patient was an athlete and he was having the hurry to go on the field, and in the second she was a homemaker. So I can't ask her to rest, but I can't ask that athlete to rest for a long. Okay, and this is how we can find out the references from the text in these particular pain conditions, and in this way we can understand the modern MRI, X-ray, USG reports and synchronize with the Ayurveda point of view. So I am going to share some of the particular things which we do at our clinic for the instant pain management and the chronic pain management also, because understand, when you are doing a treatment, when we call that we are treating a pain, we are treating a particular pain condition, like for example the most common osteoarthritis of the knee joint. When we speak that we are treating the osteoarthritis of the knee joint, or we are speaking the lumbar spondylosis. then at that time actually we are treating these all the components on your screen. Like we are treating the Asti Dhatu, we are treating the Snayu, we are treating the Sira Kandara. Then we are treating the Peshi, we are treating the Med, Majja, Vasa and Shleshmadhara Kala and Picha. We are treating actually these particular anatomical structures. Okay. तो जब हम घर बोलते हैं तो उस घर का मतलब होता है उस घर में रहने वाले सारे पति पत्नी बच्चे दादा दादी और am I audible or is there
Yes.
any issue? Am I audible, na? Ma'am?
Yes.
Okay, okay, okay. Okay, so this actually what when we call that मैं घर जा रहा हूँ इसका मतलब क्या है हम उस मकान में जा रहे हैं उस मकान में रहने वाले उन सारे लोगों से मिलने जा रहे हैं उन लोगों से कनेक्ट हो रहे हैं उसी प्रकार when we call that we are treating the osteoarthritis we are treating the lumbar spondylosis or we are treating the any kind of patient we are treating the migraine or we are treating anything in the body it means that we are treating these sapta dhatu and their upadhatus. Do you agree with me? Then going further, this is the Vedhan Karma. So in this particular video, I am explaining that I am doing the facial release or I am okay. So in this particular video, what I have done, I have used the Vedhan Karma to release the fascia. So in this manner, you may find yourself more confident while you are understanding the modern pathophysiology of that particular disease and also treating it with the Ayurveda way. So what happens? This patient may having what happened to this patient? This patient comes to me with the stiffness after playing the volleyball. After climbing staircase for some deity visit. As you know, all know that all our deity are sitting on the top of the mountain. So he also went there, and after coming on the next day, he told me that my knees are immovable. Why this happens? Because your fascia as a response to the protective mechanism got stuck there and causes the fasciitis. And this fasciitis can be, or you can say it as a Shramajanya Vata, Vata Avrodh. So this is a kind of Avrodh Janya or Strota Avrodh Janya Vata Prakop. And we are going to release the Strota Avrodh with this Vedhan Karma. So now in this particular manner, you can understand in the both the way that you have the modern diagnosis, you have the modern pathophysiological understanding, and now you are treating with the Ayurveda way. So it will make you more confident. Now you can see that this is again a case of a runner. He is having the muscles spasm in his hamstring muscles. So here you can see that there are lots of cups. As you know that the cupping or the alabu method we are using here are fixed in his hamstring muscle, in the course of his hamstring muscle, and now I am giving him the dynamic movement or the movement in this particular manner so that the constricted fascia, also the muscle which has got the spasm will release and we are giving the more stretch on to release the fascia and also to separate the distorted fascia from the muscle, the deep myofascia and the superficial fascia from the muscle, and this will help him to release the stiffness. So coming to the next, this is our innovative laser Janubasti. As you can say that the Janubasti is going on and we are giving him the laser with this simple device. As you know that the Janubasti is a kind of Augasware. So it is also doing the Burhana of the knee joint, and the laser is penetrating deep and treating the disturbed or the broken fibers of the ligaments, tendons, and the cartilages of the knee joint. So, as in this way, you can integrate the Ayurveda with the modern science that will produce more good and immediate results. Now, here I am using the myofascial release technique, or you can see that a Mardhan also you can say in the Ayurveda point of view. This is called as a soft tissue mobilization. Here the patient was a runner again who comes to me with a complaint that when he does the extra effort in the morning, after he went to the home and he had a lunch and slept, and when he rise up or wake up in the evening, he found that his leg was not moving, and there was a restriction. He can't straight or extend his knee. So first let's see the video that what happened. So, and he was not able to flex his
हाँ, 2 सेकंड के अंदर सर वापस से ज्वाइन होते हैं। जस्ट 2 सेकंड के लिए आप 2 मिनट के लिए आप वेट कीजिए।
sorry friends, because of their power cut issue is going on here, and they are having the disturbances. So as you have seen that we were here, I think. Sorry. Am I audible properly?
Yes, sir.
Yeah, thank you. So here is the he was telling that he was unable to flex the knee beyond a certain limit, and when he was having the pain at the quadricep tendons. So I am checking him in a different manner, the palpating. So he is complaining about the pain here. These are basically the quadricep tendons, and now there is unable to fold. And he was telling that he was having the pressure at that particular region, which is basically the tendons of the quadricep muscles. And here I am doing the soft tissue mobilization by releasing the deep myofascia. This is a live video shooted. There is no edition, no edit done in this particular video. So for that you should know you can see that he has flexed the complete knee, and he is telling that pain is also reduced. He is telling I can fold only up to this extent. Now you can see that after 5 minutes, again I am doing the facial release. So you must know the proper anatomy and proper the facial. So I'm separating the two quadricep muscles from each other. You can see the movement of them. Now you can see that he can completely flex the knee. Now he is telling that the pain has been reduced from 10 out of 10 to 5 to 6. So it means that half pain has been reduced. And now I am aligning his knee joint and doing a capitation. So I have to be very firm, because you all know knee joint is a very strong joint. He is telling that he is having pain, and now medial aspect adjustment, lateral aspect adjustment, And now you can see that he is more comfortable with flexing the knee. So he is telling now the pain is only 2 out of 10. Now you can see that complete flexion has been achieved. And he is telling that there is still some pain there. Again, I am separating the adjoining two muscles to release the spasm in quadricep muscles, to release the pressure or the stress on the quadricep tendons. So you can see this now, the complete flexion with pressure has been achieved. So this is how the soft tissue mobilization, the understanding of the injury can help you to treat the patient more precisely and more effectively. So I have not used any kind of instrument. I have not used any kind of needle or any kind of medicine, oil, nothing. With my finger, I have only treated the patient only because you have to properly diagnose, properly understand the injury. As you all know that Acharya Sushruta has said the fingers as a shastra also. Okay, friends. So this is what the pain, about the pain management techniques or the approach you should have. I always insist on first diagnosing. Give a time. If you have a 1 hour to treat the patient, give 50 minutes for diagnosis and treat it in 10 minutes rather than diagnosing in 10 minutes and treating in for 50 minutes. Just diagnose for 50 minutes and treat it in 10 minutes. So this is more proper approach. So we have, in collaboration with IIAS and Arvachin Gurukul, Arvachin Ayurved Gurukul, we have a common vision of empowering our Ayurveda graduates, our Ayurveda clinicians, practitioners, doctors, to practice in the multidimensional way with the to match their knowledge and to match their understanding in the modern era. Because nowadays you can't say that Vat Pitta Cup is all and everything, because patients are coming to you with the Google diagnosis and with the modern diagnosis. So you should be able to tackle with them. You should be yourself should be confident upon both these things. You can set the protocols for the treatment so that you can treat more and more patients in shorter time. So for this purpose, we are launching a course with IIAS, that is Master Class in Ayurvedic Orthopedics, a 6-month comprehensive course for Ayurveda doctors. So just stay with me for a few minutes. I will elaborate something. So this is a course module that 70% of the daily OPD patients are above pain cases, as you know that, or related to the arthritis or orthotics, in the general practice or in the Ayurveda practice also. So we are here to upgrade your skills. No matter what you practice, maybe you are a general practitioner, maybe you are Ayurveda practitioner, maybe you are thinking of starting a new practice. This course is going to help everybody. And we are going to give this 6-month exclusively course with just have a look over the format of the course, that we are having the 12 modules covering each and every aspect of the orthopedic practice. All that I have achieved in last 12 years, I am going to share with you. So these are the 12 modules. Basically, the module are like the general anatomy, functional anatomy, the Saptadhatu concept of the Ayurveda, also the functional anatomy of the spine and joints. We are going to discuss in that. Then we are also going to understand the pain gate mechanism, that how the pain mechanism happens in our body and how the treatment, how we can help, or how the pain can be relieved with which kind of treatment, or how, what is the response of the body to the treatment. Then we are going to elaborate the Ayurved Vat Vichar, then also the classification, in-depth classification of the pain to understand it in the more precise way. The Vat Rog, Samanya and Vishesh Chikitsa, which we have learned in the first year, but because of some busy schedule, we are not following it. We are going to revise it and also going to add some more concepts in it. Then we are going to understand the clinical diagnosis. Also, my own specialty is the postural analysis and postural correction. We are going to learn the postural analysis, the radiological analysis, and the pathological analysis of the particular diseases. In the fourth module, we are going to understand how to set the Panchakarma protocols, regular Upakarmas, and modified Upakarmas. As I have seen you, the laser Janubasti, we also do the traction Janubasti. We also the ultrasound massage. Then also we are going to discuss Panchakarma, the modified and regular Agni Karma and Vedhan Karma, like Gambhir Vedhan Karma and Uttan Vedhan Karma, modified part of the modified way of the Agni Karma. Also, there the other modalities like cupping, the different modules of cupping, like dry, wet, dynamic cupping, the gliding technique of the cupping, the various uses of the cups in treating the patient. Also, as you have seen the Bandhan and Lepan, so we are going to see that Bandhan and Lepan, kinesiological taping, myofascial release, trigger point therapy, which I have demonstrated into the last video, where I have done the trigger point and the Marma Chikitsa along with the osteopathic articulations combined with the cupping. Then the soft tissue mobilization in the last video, as we have seen, the in the quadricep muscles. From module 7 to module 11, we are going how to integrate all these modalities, segment wise. For example, for the cervical spine, that how can we diagnose, then how can we treat, how to rehab, then thoracic, then lumbar spine, then we are going to elaborate each joint after joint, each module having the each segment, different segment. For example, in the 7th segment, you can see that we are seeing the spine. Then 8th segment, we are seeing the upper body joints like shoulder, elbow, and wrist. In 9th module, we are going to see the lower limbs like hip, knee, and ankle joint. Then in the module 10, we are going to see about some of the rare cases in the rheumatisms. For example, RA, HLA-B27 positive patient. Again, the post-viral arthralgia, post-streptococcal arthralgia, ankylosis. We are going to see some special conditions which are being explained, like Avahuk and ankylosing spondylosis, along with the Urustamba, or there are many more conditions we are going to see in the module 11. And in the module 12, we will have some of the experts of diet and nutrition with us, and we are going to share that diet and nutrition for the particular arthritic conditions, for particular pain conditions. So all these things we are going to cover under this course. So in short, you are going to learn these many modalities like functional anatomy, diagnosis, Marma Chikitsa, Bandha, Agni Karma, cupping, innovative panchakarma, posture correction, myofascial release, gambhir vedan, dry needling, trigger point therapy, posture correction, osteopathic articulation of the spine and joints, instrument assisted soft tissue mobilization, that is ISTM, muscle energy techniques, and many more things which are beyond these presentations, because we are having one-to-one communication. We will have after each module we will have interactive sessions, doubt solving sessions. So for this I will be going to your faculty, or I will going to share my knowledge with you. My name as Dr. Manjusha already introduced me, but the one thing I'm practicing from last 12 years and practicing as an exclusive pain management specialist from last 8 years. So I'm founder and chief consultant at my Ayurved multi-speciality Ayurved hospital. So, but what is the, and all this knowledge which I have packed you or wrapped you in a one course, I have gathered from these all renowned practitioners, all renowned teachers of the pain management and manual therapies from all over the world. After doing the 8 to 9 years of exclusive learning over the pain and pain psychology, sport injury management, pain rehab, integrating with the Ayurveda. So all this bunch and all this bunch or all this packet, I am coming with you with a single course. ऐसा समझिए कि मेरी पिछले 8 सालों की मेहनत मैंने इस एक कोर्स में डाल दी है. सो नॉर्मली अगर इस कोर्स को जो मेरा एक्सपेंस निकाले या कोई भी अगर ये सारी चीजों को अलग अलग सीखना चाहे, सेपरेटली सीखना चाहे, तो अप्रोक्सीमेटली कॉस्टिंग आएगा 20,000. लेकिन हमारा 2 लाख रुपीज इसका अप्रोक्सीमेशन कॉस्ट आएगा, लेकिन हम इसको 10% वैल्यू में यानी 20,000 में हमने इसे करने की कोशिश की है. और यकीन मानिए ये 20,000 जो है ये सिर्फ इसको बनाने का और चलाने का खर्चा है. सो वी आर गिविंग इट यू इन बिकॉज मेरा खुद का ऐसा मानना है कि बिकॉज ऑफ वन इंसिडेंट इन 2016 मैंने मेरा हॉस्पिटल, मेरा गवर्नमेंट जॉब, मेरा प्राइवेट प्रैक्टिस, एलोपैथी प्रैक्टिस छोड़ के मैंने आयुर्वेद प्रैक्टिस शुरू किया है मेरे गुरु डॉक्टर रामदास अवार्ड सर के कहने पे. और बिलीव कीजिए आई एम मोर देन हैप्पी. मुझे टोटल 14 साल हो गए हैं प्रैक्टिस को. उसमें से अगर 2 पार्ट किए कि पहले 7 साल जो मैंने एलोपैथी प्रैक्टिस किया जिसके साथ में थोड़ा बहुत आयुर्वेद करता था, और उसके बाद में पूरी तरह से जब 100% और वो भी एक ही ओनली पेन, स्ट्रेस एंड स्पोर्ट इंजरी मैनेजमेंट प्रैक्टिस कर रहा हूं. तो ये पूरा ब्रंच आई एम कमिंग विथ यू इन दिस पर्टिकुलर कोर्स. और इस कोर्स को आज जो हमने ये सीरीज चालू की है, ये सीरीज तो आपके लिए फ्री है. हम 4 से 6 लेक्चर इस सीरीज में लेंगे. जैसा आज हमने कुछ केसेस डिस्कस किए, अगली बार से हम कुछ केसेस डिस्कस करेंगे अलग अलग पार्ट के. सो दिस इज अ फ्री, इसलिए दे रहा हूं कि मैं ऐसा चाहता हूं कि जितने भी आयुर्वेद प्रैक्टिशनर्स प्रैक्टिस कर लिए BMS पास होने के बाद प्रैक्टिस करना चाहे, वो सारे के सारे आयुर्वेद प्रैक्टिस करें. हम यहाँ पे कंपटीशन नहीं बढ़ाना चाहते, हम यहाँ पे आयुर्वेद का प्रचार करना चाहते हैं. And but for that purpose, each and every Ayurvedacharya should feel confident in this modern era. And the special discount जो इस बैच को जो लोग लर्निंग के लिए अपने टाइम निकाल के यहाँ पर है, कि अगर आप 1 जून तक रजिस्टर करते हैं तो देन दिस कोर्स विल ओनली कॉस्ट 15,000 आपके लिए. और IIS की तरफ से जो कि डॉक्टर ललित हेड़ा सर और डॉक्टर मंजूषा चित्ते मैडम का फाउंडेशन है, उन्होंने मुझे रिक्वेस्ट किया कि सर अगर इस कोर्स के बाद 48 आवर्स में कोई लोग ना भी इतने बड़े कॉस्टिंग के लिए अगर सोच रहे हैं तो दे कैन ज्वाइन विद इन 48 आवर्स. अगर आप रजिस्टर करते हैं तो आप 3,000 में आपका ये बुक कर सकते हैं. बाकी का पेमेंट आप कोर्स शुरू करने के पहले कर सकते हैं. सो आफ्टर फिनिशिंग दिस पर्टिकुलर प्रेजेंटेशन और ये चीज, देखिए ये वंस इन अ लाइफ टाइम ये होने वाली है। और इससे भी आगे जाके, क्योंकि जब हम ये कोर्स डिजाइन कर रहे थे, जब हम ये चीजें बात कर रहे थे, तो बहुत सारे क्वेश्चंस थे। इससे पहले भी ऑनलाइन कोर्सेस में कुछ लोग मुझसे जुड़ चुके होंगे। जैसे कि हमने जानू वेदा किया था, उसके बाद में हमने आर्ट ऑफ पेन मैनेजमेंट का एक कोर्स किया, और हाल ही में हमने स्पोर्ट्स वेदा नाम का एक कोर्स किया है, जिसमें हमने स्पोर्ट इंजरी आयुर्वेद पॉइंट से, तो उसमें से भी कुछ लोग जुड़े होंगे। तो बहुत बार हमें ये बोला गया कि सर क्या हम ऑनलाइन देख के और समझ के हम प्रैक्टिस कर सकते हैं क्या? सो फॉर दोज पीपल, और फॉर द फर्स्ट 50 पीपल जो रजिस्टर करेंगे, उनके लिए ये स्पेशल बेनिफिट तो है कि उनका 15,000 में रजिस्ट्रेशन होगा। लेकिन एक मैं मेरे तरफ से बोनस दे रहा हूँ, एंड इट इज कंप्लीटली, आप सब लोग समझ सकते हैं कि इट इज नेवर, ये कहीं पर भी फ्री नहीं हो सकता। बट मैं चाहता हूँ कि मेरा हर एक BAMS साथी, हर एक आयुर्वेदाचार्य आयुर्वेद की प्रैक्टिस करे। उसके लिए सबसे बड़ा बोनस है कि 2 दिन का ऑफलाइन वर्कशॉप हम रखेंगे, जो कि आप जो फर्स्ट 50 लोग होंगे उनके लिए कंप्लीटली फ्री रहेगा। जो ये कोर्स पूरा हो जाएगा, 6 मंथ का जब थ्योरी और प्रैक्टिकल हम पूरा डेमोन्स्ट्रेशन जब सीख लेंगे, तो 2 दिन का कोर्स रहेगा, रेसिडेंशियल कोर्स। इसमें हम आपको विथ एकोमोडेशन कंप्लीटली फ्री रहेगा, जिसकी अमूमन कॉस्ट जब मैं करता हूं तो 15,000 होता है, और जिसमें इतनी सारी मोडेलिटीज और थेरी नहीं पढ़ाई जाती है। केवल पर्टिकुलर कायरोप्रैक्टिक या ऑस्टियोपैथी या फिर वेधन या फिर मर्म चिकित्सा, इन पे ही ये कोर्स होता है। बट इसमें पूरा रिवाइज होगा। आप जो जो चीजें इस 6 महीने के कोर्स में पढ़ोगे, जिसमें जो डाउट रहेंगे, वो हैंड्स ऑन 1-to-1 क्लियर की जाएगी। So this is a mega bonus for you all people for first 50 admissions. So for details आपकी स्क्रीन पे हो गए। इसके बारे में कोई भी क्वीरीज अगर आपको है, कोई भी आपके पास सवाल है, तो आप इन नंबर्स को नोट कर सकते हैं, आप स्क्रीनशॉट लेके रख सकते हैं। इफ मंजूषा मैडम और ललित हेड़ा सर अगर है, तो मैं उनसे रिक्वेस्ट करूंगा, प्लीज सर।
IIAS हमने जब बनाया था, तो हमारा जो मेन एम था कि आयुर्वेद प्रैक्टिशनर, आयुर्वेद सुपर स्पेशलिटी क्लिनिक स्टार्ट हो। उसी एम से हमने लास्ट 4 सालों से काम किया है। मैं और मंजूषा मैडम डरमेट और प्रोडक्ट मेकिंग में सिखाते हैं। लगभग 2700 से ऊपर प्रोडक्ट मेकिंग के अपने स्टूडेंट्स हुए हैं, जिनमें से 8 से 10 लोगों ने प्रोडक्शन यूनिट स्टार्ट किया है। लास्ट 1 साल से हम सोच रहे हैं कि आयुर्वेद स्पेशलिटी प्रैक्टिस बढ़ाने के लिए और क्या करना चाहिए। तो उसमें से एक कंसेप्ट या इन सब लोगों के साथ काम करते हुए एक चीज हमारे ध्यान में आई है कि हमें आने वाले 3 से 4 सालों में एक स्पेशलिटी में काम करने वाले 500 से 1000 लोग एक जगह चाहिए, उनकी एक कम्युनिटी बनना चाहिए। और उसी हेतु से हम लोगों ने कुछ, जैसे स्वप्निल गावंडे सर, हर स्पेशलिटी के लिए एक अच्छा फैकल्टी हमने देखा है और उनके साथ हम काम कर रहे हैं। तो इसमें जैसे कि जो हमारे पुराने स्टूडेंट्स अभी यहाँ ज्वाइन है, उन लोगों को पता है कि हम लोग जिन कोर्स की रिकॉर्डिंग हमने 3 महीने कहा था, आज भी 3 साल होते हुए भी हमने ये चीजें अभी तक हमारे ऐप पर रिकॉर्डिंग अवेलेबल रखी है। तो हमारा पर्पज, जो मेन पर्पज है कि आप सब लोगों ने आयुर्वेद सुपर स्पेशलिटी प्रैक्टिस स्टार्ट करना चाहिए। और इसी उद्देश्य से हम ये कोर्स लेके आ रहे हैं, जहां पर एक 2 लाख कॉस्टिंग का कोर्स सिर्फ आपको 15,000 में मिल रहा है। साथ में हम 2 दिन का ऑफलाइन वर्कशॉप भी रख रहे हैं। तो यह सब चीजें इसके लिए है कि आप आयुर्वेद सुपर स्पेशलिटी प्रैक्टिस में आए, एक हमारे ग्रुप से जुड़े। आने वाले दिनों में हमें एक स्पोर्ट इंजरी रहो या आयुर्वेद ऑर्थोपेडिक रहो, यहाँ पर हमें एक 500 से 1000 लोगों का ग्रुप बनाना है, जिसमें हम एक दूसरे को मदद करेंगे, हमारे पार्टिसिपेंट भी एक दूसरे को मदद करेंगे, साथ में हमारे कंधे से कंधा मिला के चलने वाले हमारे फैकल्टी भी हमारे साथ में है। और यह सब चीजें जब तक हम नहीं करेंगे तब तक अच्छे से आयुर्वेद सुपर स्पेशलिटी क्लिनिक डेवलप नहीं होने वाले हैं। तो मैं आप सभी को और एक चीज कहना चाहता हूं कि लगभग 70 के ऊपर हमारे आज तक वर्कशॉप हुए हैं। हम ये सभी कोर्स की इंफॉर्मेशन सब जगह अभी शेयर नहीं करने वाले, क्योंकि कुछ लिमिटेड लोगों के साथ ही हमें काम करना है शुरुआत की बैच में, और वही हिसाब से अभी यह सब ऑफर आप सब लोगों के लिए है। तो मुझे ऐसे लगता है, सर ने जैसे कहा है, अगर आप आज बुक सीट करना चाहते हैं तो 3000 नॉन रिफंडेबल अमाउंट के साथ आज सीट बुक कर सकते हैं। आज आपको 15,000 रुपए में दोनों भी चीजें 6 मंथ कोर्स प्लस 2 डे ऑफलाइन वर्कशॉप विथ फूड और अकोमोडेशन आपको मिलेगा। इसके बाद में भी आपकी कुछ क्वेरीज रहती है तो प्लीज आप पूछ सकते हैं।
सर अनम्यूट ऑल करून. हाँ नहीं नहीं, तू अनम्यूट. सर ने अनम्यूट किया है, तो जिनको क्वेश्चन पूछना है वो खुद को अनम्यूट करके क्वेश्चन पूछ सकते हैं.
सर ये ऑफलाइन जो होगा 2 दिन का, वो कब से होगा?
मोस्ट प्रोबेबली मैडम मेरे खुद के सेटअप, मेरे खुद के गांव अकोला में होगा. तो अकोला इज वेरी इजी टू रीच, क्योंकि चारों साइड से ट्रेन अकोला आते हैं. नियर बाय एयरपोर्ट जो है वो नागपुर है, जो कि 200 किलोमीटर है. बाकी मुंबई, दिल्ली और कंट्री के हर कोने से ये आ जाते हैं.
और 6 मंथ का जो ये है, तो लेक्चर्स डेली रहेंगे या वीकली, कैसे
नहीं मैडम,
रहेंगे?
मोस्ट प्रोबेबली वीक में 3 दिन लेक्चर रहेगा. अभी 6 महीने का लॉन्ग पीरियड होता है. 180 दिन को अगर आप डिसाइड करो तो 2.5 दिन हमें आते हैं. इसका मतलब हम हफ्ते में 2 या 3 दिन लेक्चर रखेंगे, और हम कोशिश करेंगे कि ये वीकडेज में रखा जाए, या तो आफ्टरनून या तो नाइट में, क्योंकि बहुत सारे प्रैक्टिशनर्स हैं और हम हर सैटरडे संडे इन्वेस्ट नहीं कर सकते, क्योंकि फैमिली को भी टाइम देना है. तो वीक डेज में हम 2 या 3, और इसकी रिकॉर्डिंग्स अगर आप कोई मिस भी करते हो लेक्चर, तो आपको रिकॉर्डिंग मिलेगा. लेकिन मैं इंसिस्ट करूंगा कि लाइव लेक्चर में अगर रहते हैं तो ज्यादा प्रॉपर अंडरस्टैंडिंग आता है.
ओके।
एनी क्वेश्चंस? गौरव पुरी सर ने पूछा बैच कब से. माइट बी इन द लास्ट वीक ऑफ द नेक्स्ट मंथ, जून के लास्ट वीक से. वी विल डिक्लेयर इट सून.
मैंने आपको म्यूट किया है सभी को, क्योंकि बीच में बहुत सा डिस्टरबेंस था। तो प्लीज जिनको भी क्वेश्चंस पूछना है खुद को अनम्यूट करके आप क्वेश्चंस पूछ सकते हैं।
कोर्स कब स्टार्ट होने वाला है?
जुलाई मंथ फर्स्ट वीक में कोर्स स्टार्ट होगा। और किसी के कुछ क्वेश्चंस होंगे तो प्लीज आप अनम्यूट करके पूछ सकते हैं, या चैट बॉक्स में भी आप डाल सकते हैं। हाँ, इसका सर्टिफिकेट भी आपको मिलेगा ऑलरेडी। हमारे शॉर्ट कोर्स हो चुके हैं, जैसे नी पेन पर एक था, स्पोर्ट इंजुरी पर एक था। बट हमारा एक एक्सपीरियंस रहा है और पुराने स्टूडेंट्स का भी जो सजेशन था कि एक कंप्लीट कोर्स होना चाहिए, क्योंकि हम अगर पूरी चीज सीखेंगे तो रिजल्ट उतने अच्छे आते हैं।
हाँ सर। दोनों। सर yes. Sorry, I was mute. Actually, I was giving answer, but I now recognize that I was mute. So the first question is that the course is going to be starting the first week of the July month. Then there is a does sir have any center in Pune? No, I don't have any center in Pune, but I am planning to start a visit from next month in Pune. The timing of the class, that is most probably in the evening after completing my OPD, or in the afternoon, and approximately 2 or 3 classes in a week will be done with each module, so that there will be the proper understanding of every segment. Then somebody, Mr. Om Prakash, asked that Januveda sport injury bhi padayenge. Yes, Januveda and sport injury bhi padayenge, because this is a comprehensive course. इसमें मैं कुछ भी ऐसा नहीं रखूंगा जो मुझे आता है. The only thing will be left which I don't know. So this is very clear. Yes, Mr. Gaurav sir, we are going to provide the certificate from our side. Also, we can't commit it right now, but we will try to give you also some of the accreditation certificate also. Offline session, if not heard, I will again explain. That is, most of the time it will be in Akola. Akola is at the center of the country, so you can have a train from anywhere, all over from India, comes to Akola directly. The nearby airport is Nagpur, because it is very convenient for me, and it will be very beneficial for you too, because I may share you my practical experiences at my own clinic also. And the study material, so there is no specific study material. Your reading will be the study material. Definitely, we are going to share some of the books to you, which you can refer for the studies and references. Yeah, definitely, there are some things which I will provide from my side. This is 6-month course, is approved to any university or any technical board. Right now, Dr. Kapgate sir, it is not. It is a knowledge sharing course, but definitely we are
सर 2 मिनट में ज्वाइन होते ही है
हाँ नहीं
तो
मैं ज्वाइन हो गया
emails-
हूँ, कोई इशू नहीं सर। एम आई ऑडिबल ना? यस सॉरी, एक्चुअली आज बहुत ज्यादा डिस्टर्बेंसेस हुआ बिकॉज ऑफ पावर कट, तो वाईफाई बंद हो रहा था। यस, सो एनी क्वेश्चन विच इज अनआंसर्ड? सर आजचे रेकॉर्डिंग मिळेल का? येस देशपांडे मॅडम, वी आर ट्राईंग की आजचे रेकॉर्डिंग द्यायचा प्रयत्न नक्कीच करूयात आपण.
सर एक क्वेश्चन था टाइम इन आवर्स, तो आज का
टाइम इन
लेक्चर
आवर, आज का लेक्चर थोड़ा सा खिंच गया है, लेकिन 1 से 1.5 घंटे का नॉर्मली लेक्चर रहेगा.
सबसे इंपॉर्टेंट चीज सबको मैं बताना चाहूंगा कि टॉपिक आपको अच्छे से क्लियर होना चाहिए, आपके प्रैक्टिस में ये सब चीजें आप लाना चाहिए। इसके रिगार्डिंग सर और हम लोग हमारे तरफ से पूरी कोशिश करेंगे, यानी स्टडी मटेरियल रहो या बाकी जो चीजें आप पूछ रहे हैं, तो टीचिंग स्टाइल जैसे आज आपने देखा है कि वीडियो डेमोन्स्ट्रेशन, यह सब चीजें इतनी अच्छी सी रहेगी कि आप सब लोग एक फ्लो में अगर हमारे साथ लेक्चर करेंगे तो यह सब चीजें प्रैक्टिस में आप अच्छे से कर पाओगे।
लेपन इंग्रेडिएंट्स आर द संधानक द्रव्य इन चरक संहिता. संधानक गण you can also unmute and ask the question. Huh?
किसी के कुछ और डाउट्स रहे होंगे तो प्लीज आप अनम्यूट करके सर को क्वेश्चंस पूछ सकते हैं या चैट बॉक्स में भी डाल सकते हैं।
लेपन इंग्रेडिएंट मैडम कुमारी गुग्गुळ हाडजोळ रेवंचिनी लोध्र शिरीष सज्जिक्षार and मोचरस. These are the 8 main ingredients in the Munde Baba Sahib to everyone. Sir, what motivated you to learn and start this course? So there are lots of things which motivated me to start this course, which motivated me to motivate all these children who comes to me to meet, to interact. That what sir, what should we do? So there are lots of my friends I initiate who are struggling in their general practice. I always, all the time I say them that come to Ayurveda, become a specialist. The one thing, as I have told you, before 2016 or up to 2016, I was practicing as a general practitioner in Kalyan. I was having the 2 hospitals, and I was a class 1 medical officer in the municipal corporation. I have left everything and start Ayurveda practice because my guru Dr. Awad sir has said one thing, that स्वप्निल तू एक बहुत अच्छा डॉक्टर है, लेकिन तू जिंदगी में कभी भी नंबर 1 नहीं बन सकता है, बिकॉज यू आर प्रैक्टिसिंग सम वन अदर्स पैथी. अगर आप आयुर्वेद प्रैक्टिस करोगे तो यू कैन बी नंबर 1 in your field. So why you are wasting your talent, why you are wasting your knowledge and courage in becoming the number 2 or the alternative for a physician? Though I have done more than 1500 done more than 1500 intubations, or done lots of central lines, attended from neurosurgery to the simple laparotomies and other surgeries. But the one particular sentence that I can't be number 1 motivated me, and I want because you know that your respect, your courage, your ego or your ahankar can only be satisfied in a good community. I don't want to see, or I feel very bad I feel very bad when I see some or the other BMS people or general practitioners are struggling and struggling to get that respect. Struggling not only for the patients, not only for the money, but struggling for that particular aura of a doctor. Why can't we be the consultant? You know, I never got a direct patient. Very, very rarely I got the direct patient. I always get the patient which are been untreated, which are not been satisfied, or which are not been properly diagnosed by the orthopedic surgeons. जो भी पेशेंट मेरे क्लिनिक में आता है ना, 6-7 ऑर्थोपेडिक सर्जन, न्यूरो सर्जन की फाइल्स लेके आता है. बहुत रेयरली होता है कि तो पेशेंट मेरे पास डायरेक्टली आया हुआ है. और जब वो सेटिस्फेक्शन होता है, जब वो पेशेंट बोलता है कि डॉक्टर साहब हम 10 जगह गए, हम 4 जगह गए, हमें वो सेटिस्फेक्शन नहीं मिला, या हमें वो रिलीफ नहीं मिला जो आपके पास आके मिला. आई एम नॉट गारंटी कि आप 100% पेशेंट ठीक कर पाओगे. 100% कोई भी ठीक नहीं कर पाता. टू बी ऑनेस्ट विथ माई सेल्फ, टू बी ऑनेस्ट विथ यू ऑल पीपल. बट आप जितने भी पेशेंट को ट्रीट करोगे, डायग्नोस करोगे, बहुत बार अगर आप डायग्नोस करके पेशेंट को ये भी बोल दोगे कि यू आर नॉट गोइंग टू बी हील, आपका ये ठीक नहीं हो सकता है, या आपको ये करना ही पड़ेगा, दो यू आर नॉट ट्रीटिंग हिम, तो भी पेशेंट आपके पास वही पेशेंट 10 पेशेंट बुलाएगा कि नहीं, ये डॉक्टर है, इनका नॉलेज बहुत अच्छा है, इन्होंने बहुत अच्छे से मुझे समझाया. तो ये जो सारी चीजें हैं, ये कहीं तो भी आपको जॉब सेटिस्फैक्शन देगा, पैसे भी देगा, नेम फेम और इज्जत भी देगा. आज अगर मेरे आजू बाजू में 10 आयुर्वेद स्पेशलिस्ट डॉक्टर बैठे हैं, तो हमें कितना अच्छा लगेगा. फिर क्योंकि जब आपके कलीग्स का रिस्पेक्ट होगा तो आपका रिस्पेक्ट होगा. डॉक्टर्स बड़े होंगे तो देखिए, एक सिंपल चीज है, हमें आयुर्वेद को बड़ा करने की जरूरत नहीं है. आयुर्वेद ऑलरेडी बड़ा है. 5,000 सालों से, 10,000 सालों से आयुर्वेद अगर टिका है तो वो ऑलरेडी बहुत महान है. हमें उसे महान बनाने की जरूरत नहीं है. हमें बड़ा बनना है. हम अगर बड़ा बनेंगे तो अपने आप आयुर्वेद भी बड़ा बनेगा, और हम जब दोनों बड़े बनेंगे, हमारा शास्त्र बड़ा बनेगा, हम बड़ा बनेंगे, तो हम एक अच्छा फ्यूचर. ये जो टैग लगा है अल्टरनेटिव थेरेपी का आयुर्वेद पे, अल्टरनेटिव मेडिसिन का, वो मुझे हटाना है. अब मुझे बोलोगा, कोई बोलेगा कि आप फ्री क्यों नहीं पढ़ाते हो, तो फ्री की कीमत नहीं होती है. इसीलिए मैंने कहा कि जो कोर्स मैं आपको 15,000 में ऑफर कर रहा हूँ, या जो 50,000, इसके लिए मैंने कम से कम 8 से 10 लाख खर्चा किया होगा. ये तो 2 लाख रुपीज, और वो भी मेरे प्रैक्टिस के 10 साल बाद. तो दिस ऑल थिंग मुझे नहीं लगता कि ये हर एक ने स्ट्रगल करना चाहिए. और इसीलिए मुझे ऐसा लगता है कि मोस्ट ऑफ द लोग यहाँ से मोटिवेट हो. आई डोंट केयर कितने लोग रजिस्टर करेंगे, कितने लोग नहीं करेंगे, बट आई एम ओपन फॉर ऑल. Thank you, Munde sir. Thank you very much. Sir, is there any particular type size needle that you are using in Vidya Karma? Ma'am, in Vidya Karma, when we call it as Ayurvedic Vidya Karma, we use the 26 number needle or insulin syringe. But also I do the dry needling or the Gambhir Vedan Karma. In that, from 25 mm to 100 mm of the needle we use. It depends on where you have to do the Agni Karma. If you want to do the in the rhomboid muscle, you have to go more deeper. You will need the 60 mm or 75 mm needle. If you just want to do superficially, the 13.5 mm needle will be sufficient. So it depends. Then is there any chance of new nerve soft tissue damage during the Vidya Karma? No, madam. If you are doing the Vidya Karma with 13.5 needle or insulin syringe, there is a very or negligible chance of happening the nerve. Don't fear. अगर हमारे बीएमएस जनरल प्रैक्टिशनर बटक में आईवी लगा सकते, बटक में इंजेक्शन दे सकते हैं, आईवी दे सकते हैं, तो व्हाई यू आर अफ्रेड ऑफ हैविंग द आयुर्वेद modalities? You are licensed to do that. You have learned that. Vedan karma, Agni karma, Basti, Panchakarma, don't fear. They are more safer than the using the diclofenac and all the NSAIDs and all the other modern medicines. They are more safer than that. So don't fear. Would you like to thank you, Dr. Shraddha ma'am? Sir, आपण experience share Thank you, Dr. Keshav Kapgate sir. Thank you very much for your kind words. मी एक छोटासा सेवक आहे, फक्त माझ्याकडून जेवढं होतं तेवढं करण्याचा प्रयत्न करतोय. Achal, I don't know because Achal is a common name in male and female. But Dr. Achal, I would say that first of all, when you are speaking about the PCL injury, we have discussed in the today's lecture that when you are treating something, you are not treating that particular joint, you are treating the ligament, you are treating the tendon, you are treating the muscle, you are treating the fascia, you are treating the bursa, you are treating the popliteal fossa when you are treating the PCL injury. So first of all, understand, don't ask these ready-made answers. Sir, what is the treatment for this? And what is the first understand it, treatment will automatically outcome from your side. This is just a copying of practice. Ayurveda is not allopathy. सर्दी खांसी है, एक अजिथ्रोमाइसिन दे दो, एक सेट्रिजिन दे दो, एक डोलो दे दो. दुनिया के हर पेशेंट को एक ही फॉर्मूला रहेगा सर्दी खांसी का. बट व्हेन इट कम्स टू आयुर्वेदा, इट विल हैव द कफज प्रतिशय, पित्तस प्रतिशय, वातस प्रतिशय, संधिपातस प्रतिशय, द्विदशिश प्रतिशय. So there in Ayurveda there are no direct answers. And if you can understand this, you can practice Ayurveda. Or otherwise you are just copying something else. I don't want to create Swapnil Gavandes. One Swapnil Gavande is enough. People are bearing him. एक को झेल रहे बहुत हो गया. मुझे बहुत सारे स्वप्निल गावंडे नहीं बनाना है. I want everybody's initial individual identity. और उनसे मुझे बहुत सारा सीखना है. I think there are no more questions, and as I'm thank you, Dr. Varsha ma'am. Thank you for your kind words. I'm once again sharing already in the chat. The details are shared. I am again sharing that if you have any queries regarding the course, regarding the thing, stay connected with this number, join our groups so that the next so thank you. Wish you a very happy evening. Wish you a very happy upcoming weekend. See you soon in the next lecture. Till then, take the benefit. Get registered within 48 hours so that you will be eligible to the mega bonus of offline workshop. With the permission of Dr. Lalit sir and Dr. Manjusha madam, I am going to end the meeting. Dr.
Yes,
Lalit sir.
Yes, sir. Yes, sir. Thanks, sir.
Thank you very much for providing this wonderful opportunity, sir.